Hello, I would like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I'm also co-host on the show It's About You on WKYC Channel 3, where weekly I recognize people that are everyday champions. But right now, this web series is about your health. It's about you, that's right, especially during a pandemic. However, this web series is also about community. I felt compelled to make sure that we get to the latest information in all areas of health. And that's why I'm pleased to be partnering with the university hospitals to spread the word in our community about how you can live a healthier life. Today, I'll be speaking with Dr. Robert Richardson of University Hospitals. Thanks again for being on the segment, Dr. Richardson.
Hi, I'm happy to be here. Happy to teach.
Yeah, that's right, to teach. So tell us about what you're going to talk about today.
Well, today I'm going to talk to you about stroke,
Okay.
and the reason to do it. Well, first, even without the pandemic, stroke is something of an epidemic in the Black community because we are more likely to have some of the risk factors for stroke.
Mm-hmm.
During the pandemic, this has become a bit more useful because some patients with COVID are likelier to have stroke because one of the things that can happen during a COVID infection is that people develop, we call it hypercoagulable state. That means your blood is easier to clot, and so you're more likely to have stroke. So I usually like to talk about how to prevent stroke in the first place, because if you're looking up at me from the gurney in the emergency room or in the hospital, you know there's something wrong.
Yeah.
And second, what to do if you have symptoms that are stroke-like,
Wow.
and hopefully to do so quickly.
That's right. Definitely do it quickly. So, Dr. Richardson, let's just start with kind of what is a stroke to all of our viewers. What will we characterize as the definition of a stroke?
Okay, that's a very good question to start with. Well, a stroke is what happens when a part of your brain is starved of its blood supply. Okay. It can happen two ways. One way, and the most common way actually, is with a blood clot or with goop, usually cholesterol goop, filling up one of the arteries inside the brain. Mm-hmm. The other way, and this is thankfully less common, only about 20% of strokes manifest this way, is through rupture of one of the blood vessels, and that can be from aneurysm or from rupture of a smaller blood vessel. Typically, that'll come from someone who's got high blood pressure.
Okay.
So pretty simple. Part of the brain is starved of blood.
Okay. That makes a lot of sense. And so how do we prevent it, Dr. Richardson? Well,
we divide the risk factors into a couple of classes. One class we can't do anything about.
Okay.
The most important risk factor for stroke is age, and obviously we can't do anything about age.
That's
Sorry
true.
about that. The risk for stroke increases pretty significantly after about the early 50s, though people of any age can have stroke. I mean, I've seen stroke in someone as young as in their 20s, and for someone with sickle cell disease, I mean, even a child can have stroke.
Wow.
Being African American is a significant risk factor for stroke. We think that may be because we are, again, likelier to have some of the risk factors for stroke.
Wow.
And that brings me to some of the preventable risk factors for stroke. High blood pressure is the number one risk factor for stroke.
Okay.
And as many of us know, I mean, there's a virtual epidemic of it in the Black community. I have high blood pressure myself. I'm on medication.
Wow.
I have to be on medication for it because I don't want to have a stroke either.
Exactly.
Diabetes is a risk factor for stroke. Heart disease is a risk factor for stroke because the same arteries that get plugged up to cause a heart attack, the same disease can affect the blood vessels inside the brain. Mm-hmm. Also, some people will have an irregular heartbeat, atrial fibrillation. You've seen the ads on TV for Eliquis to thin your blood, etc. If you have atrial fibrillation,
Mm-hmm.
That's another risk factor.
Mm-hmm.
Smoking, especially in women, it triples the risk for stroke. So, that's yet another reason to quit smoking. For
Wow.
men, it's slightly less than triple, but still very, very high risk for
Mm-hmm.
stroke.
Mm-hmm.
So those are some of the risk factors that we can do something about. I mean, basically, quit smoking.
Okay.
If you have high cholesterol, take your cholesterol lowering medication. If
Right.
you're diabetic, make sure your sugar's under control. And
Mm-hmm.
if you have high blood pressure, make sure you treat it. We call it. Many people call it the silent killer, right? Because many people you can't feel high blood pressure unless it's extremely elevated.
Mm-hmm.
I mean, before I was diagnosed with high blood pressure, I had no symptoms at all, nothing.
Wow.
I had no idea. I went to a doctor's appointment, and gee, doc, your blood pressure is running a little high.
Wow.
And I ended up on medication.
I don't even know why.
Yeah. Well, in my case, it runs in the family. Oh, it probably runs in your family too.
That's true. That's very true. Wow. So Dr. Richardson, my question is, even though we know it can sneak up on you, are there some things that we can do when it comes to like our diet or even exercise? Are there things that we can do to maybe help prevent it a little bit, or?
Absolutely.
Okay.
Absolutely. In addition to, if you have those conditions that I mentioned, making sure they're taken care of, even a little exercise will help. Even a little exercise. I mean, I tell people that 15 minutes on an exercise cycle, 2 or 3 times a week. Even something like that can help. Even doing some calisthenics, getting your blood moving, 2 or 3 times a week. Just that will help to reduce your blood pressure. Okay. Help if you're diabetic. Just a little exercise can help to get your blood sugar under better control. And as far as diet goes, I mean, the only thing I can really tell you is what everybody else says, which is watch the amount of cholesterol you take in. That's really a big one. Watch your salt intake. Mm-hmm. And in our houses, what the stuff that we like to eat, it all tastes good. It all has cholesterol in it. Right. It all has salt in it. And thankfully there are ways to cook it so that there's less cholesterol. And you just have to pay attention to the ingredients in your diet. Mm-hmm. Lots of veggies. I mean, these are all things that are probably not new to the people who are listening.
Right.
Just have to do them.
But you just have to do it. That's so true, Dr. Richardson. And I'd like to hear. It's
hard.
Yeah. Oh, yeah. That's true. Yeah.
It's hard.
Yeah. It's very.
I have the same fight everybody else does. I won't even lie. I have the same fight.
Everybody has the same fight, so you just got to make that decision and live that healthier life. I was going to say, what are some of the symptoms that would suggest that you're having one? I'm sure, people that are watching right now want to, say, well, what's the trigger? What is it that I'll see, that I'll know, that say, hey, you need to get some help?
Okay. Well, stroke symptoms all depend on what part of the brain is involved. Okay. So if you notice, things that you notice, if you're, we like to use a mnemonic FAST. Mm-hmm. So F is for face. So if you notice that your face is a little droopy, on just one side, that could indicate a stroke.
Okay.
Arm. Let me see. A is for arm, and really that means either arm or leg weak. It's common that that the weakness appears together on one side of the body. Speech. Okay. That S is for speech. If your speech is slurred, then that could also indicate a stroke. Okay. And T is for time. If you notice any stroke symptoms, time is of the essence. The reason being, if you get to the emergency room within 3 hours of your stroke, we have medication that we can give intravenously through the vein
Oh,
that can dissolve partially or completely the blood clot that is causing the stroke, and by doing that, we can reduce the severity of the stroke. I'm not going to say take it away,
right.
because that's not always the case. But if we can make it less severe, that means you're more likely to have a rapid recovery.
Gotcha.
So face, arm, leg, speech. Other stroke symptoms: seeing two of things at the same time. So true double vision. Off balance.
Okay.
If the part of the brain that controls your balance is not working properly, I mean, you'll know you'll be walking like you're drunk, and you haven't had anything to drink.
Wow.
Right?
Okay. Well, that's a great indicator. Yeah. Wow.
So those are all common symptoms for stroke. But the most important thing is, do not wait around. I've seen too many people wait until the next day.
Oh my
And then
God.
they show up in the hospital, and I can't do anything for them immediately. I can do all the testing in the hospital for stroke so that we prevent the next one. But if you come in within 3 hours, we could have done more.
Wow. So the message is, if you're having these symptoms, if you're seeing some things that are strange, make sure that you go get this thing checked out, because the quicker you get there, the better your results can be. Is that what we're saying, Dr. Richardson?
That's exactly it. That's exactly
great.
it. I mean, do not wait. I mean, even if you go to, it's better to be laughed at in the emergency room because your droopy face was just from a pinched nerve.
Yeah.
It's better to go to the emergency room and find out that it wasn't a stroke than to miss a stroke and be permanently disabled from it.
Gotcha.
I mean, this is
better to have
in
a
large part
than to play
we can do something.
Yeah, that's right. Do something. Well, I appreciate it, Dr. Richardson. I appreciate you giving us insight on strokes, and I want to thank you again for expanding our knowledge and sharing with us what basically University Hospitals has been doing to provide a healthier you. And so that's our segment for this week. But I want to say to all of our viewers, keep tuning in on social media as we continue to touch on topics and resources for the community. Contact me on social media or visit my website at larrymaconjr.com. Or for further information regarding your health, make sure you call University Hospital, schedule a visit. Dr. Richardson's ready for you. He's ready to talk, ready to help. And don't forget, as I'm learning from Dr. Richardson, that good health is good wealth. Thank you again, Dr. Richardson, for being on this segment.
Thank you so much. I appreciate you.
All right. Take care.
Thank you.
All right, Dr. Richardson, that was great.
Thank you.
Sounds good.
Shoot, I'm happy to come back and talk about other stuff too.
I hear you. Okay, good. We'll have you back on. That's great. But yeah, I do a show on Channel 3, so I may reach out to you. Would love to bring you on there also.
Very good. Yeah. I would be happy to do it. I mean, stroke is kind of the thing that I talk about the most because I mean it's really a big problem in our community. But I talk about other neurological conditions too, like headache and seizures and multiple sclerosis. In fact, I'm the current chairman of the board for the Kinsellers Foundation.
Okay. Oh, good. Hey, I wanted to ask you a question when you were talking about neurological conditions. I've been hearing about some folk that have a sensitivity to like a smoke smell. Is there any kind of connection to that with any neurological? I know that may be an ENT question, but just wasn't sure.
Usually when that's a new symptom, one of the, often people are referred to a neurologist first just to be sure that there's not a neurological condition. Often in that circumstance, I'll order an MRI of the brain in order to make sure that the nerves that carry information from your nose, it's really right at the bottom of the front of the brain. And if there's a tumor squashing those nerves, one of the manifestations is more often there's no smell, but sometimes the smell changes. We can also see it in the part of the brain, which is right in front of the ear that controls smell. So even an ears, nose, throat doctor will order brain imaging in that circumstance.
Is what do they usually find something, or sometimes it could be nothing? I mean, what is the thought process behind that?
Well, the idea is to look for obvious tumor, but actually the most common cause for that particular problem is head trauma,
Oh,
head
okay.
trauma or chronic sinusitis.
Okay.
With head trauma, if you hit your head, those little nerves that come directly, the nerves come directly out of your nose. They cross the skull and they enter the olfactory nerve. Those are the nerves I told you about right at the bottom of the brain. So with head trauma, those little nerves can tear. They can tear right off, and that has a direct effect on smell.
So if you have a nerve problem, how could you fix something like that, or what is?
That's something that unfortunately takes time to heal.
Okay.
It can heal by itself, but it takes a long time. There's not surgery that you can do to fix that, unfortunately.
Gotcha. So you kind of would have to live with that ailment for a while, and hopefully it would correct itself, is what you're saying.
Yeah, and it does for some people.
Okay.
And of course, with bad sinusitis, if there's enough sinusitis, it irritates the nerves and changes the sense of smell. And by the way, so the sense of smell is integrated into your sense of taste.
Wow.
If you can't smell, or if your sense of smell is different, then your sense of taste is different too. Wow. And the best way to think about this, try eating an orange when your nose is stuffed up. Doesn't taste right.
Right. That's right.
Doesn't taste right, and that's because part of tasting is that as you're biting and chewing, the smell of the orange gets in your nose, and that smell adds to the taste automatically. A lot of people don't think about that, but that's how it happens.
So sinusitis, that's an actual condition too, or?
Oh yeah. Yep. Irritation of the sinuses.
Irritation of the sinus. So irritation of the sinuses.
The sinuses are just. Oh, pardon?
Is there medication for that irritation of the sinuses?
Oh yeah. It's just inflammation generally of the lining of the sinuses, and in severe cases, there's even fluid in the sinuses, which are in your cheeks and your forehead and your and near your ears.
Gotcha.
So yeah, if it's usually it comes from seasonal allergies. Sometimes it's from infection. So the treatment depends. The treatment depends on the cause. Okay. If it's from an infection, then you need antibiotics. More commonly, it's just from inflammation, and the ENT doc has a variety of ways to treat that. Either flushing out the sinuses, using a steroid medication to get rid of the inflammation, etc.
Well, with the antibiotics, does that take a while? Antibiotics, or they're supposed to be quick?
No, they work pretty quickly. Most of the time, you go for sinusitis, you go on antibiotics for it's typically a week.
Gotcha.
Typically a week to 10 days. It all depends on how severe it is.
But it also seems very subjective, because the person has to tell you what they smell. So that's
true.
Makes it difficult.
That's true.
I would say as a
doctor, they have to tell you what they smell. Yeah. Most of the time, they don't smell, or food tastes funny.
Yeah.
But yeah, sometimes it's a weird smell, oily smell. I've heard oily smell, burned smell, poop smell. Right? So
wow.
So everybody's burden with that is different.
Yeah.
It's pretty interesting, actually.
Yeah. I've been kind of reading about it myself because of the whole link with COVID and the whole loss of taste and smell, and how it may be, possibly a long-term effect or something like that.
That's right.
Yeah.
And I've seen a few people with COVID with exactly that problem. More than likely, it's just inflammation of the nerves.
Gotcha. Okay.
And if the inflammation causes enough nerve damage, then that can indeed be a long-term effect.
I understand. So they could actually have to just live with the inflammation of the nerves for a while. Gotcha. Okay.
Well, even if the inflammation goes away, then the nerve may be damaged behind it.
Okay. Gotcha. Okay.
And then it takes time for the nerve to heal. It typically takes months.
Gotcha.
To even years.
Gotcha.
And some people may even have permanent nerve injury.
I understand. Okay. That's interesting. Sorry to pick your brain, but I kind of like
that's
too.
This is what I do all day long in the office.
That's great. That's great. Well, listen, Dr. Richardson, again, thank you for all that you've been doing, especially during this pandemic. So you keep your self healthy too, and God bless you.
I'm trying. All right, you take it easy, brother. It's a pleasure to meet you. And again, I apologize for tardiness. It's the same thing I was doing with you. I was talking with a patient. So
you got a good excuse, doctor. All right. All right. Take care.
All right. Take it easy.
All right. Thank you. Bye-bye.